New data just out today from the CDC shows just how bad this year's flu season really is. And the bad news is that it is not slowing down right now. The CDC says there have been at least 7.5 million cases so far just this season. That includes some 81,000 hospitalizations and tragically more than 3,000 deaths. Unfortunately, all of those numbers are trending upwards.
Flu activity is surging nationwide and here at home. So far this flu season, the CDC estimates there have been at least 7.5 million illnesses, 81,000 hospitalizations, and over 3,000 deaths.
This comes at a time when a new strain of the flu is filling urgent cares in hospitals throughout the country. An 11-year-old Alabama boy, Jace Watkins, died over the weekend after battling a severe case.
New this morning, a child has died from the flu virus in northern Kentucky. According to the State Department for Public Health, the child was from Kenton County and did not have the recent influenza vaccine. Officials say this is the first pediatric flu death of the season. According to officials, the best protection against the virus is a flu shot.
Another child has died as the flu surges in North Carolina. DHHS has reported 39 total flu deaths this season. Of those, 2 are children. 3 people between the ages of 25 and 49 have also died from the virus. 7 people between 50 and 64 and 27 over the age of 65. DHHS is urging everyone 6 months and older to get the flu and COVID vaccines.
The Kentucky Department of Health announces a tragedy, a pediatric flu death in Kenton County.
It's tragic, especially this time of year.
I called Skip Tate with the Northern Kentucky Health Department.
Unfortunately, the child didn't have a flu vaccine.
Welcome to this latest installment of Unwatchable Content. I am, of course, your host, RD, and in today's video, nobody is going to watch. We are once again talking about Subclade K as I bring you my latest update on an ongoing and developing story. But before we do get into this evening's topic and content, I must point out for those somebodies who are watching RD, they will probably understand as to why I must say this. But this evening's video is by no means supposed to be intended as medical advice and should not be taken as such. It is intended solely for information and entertainment purposes, and as well as those watching along, it is for conversational purposes, and the views and opinions expressed in some of the articles and videos we are going to see that are contained within this evening's Unwatchable Content are not necessarily shared by those of Shit Video Productions. With all that being said, it is good to see you folks. Welcome back, happy new year and all of that jazz. Hopefully you enjoyed your festive period with friends, family or loved one, or if you're like me, maybe you enjoyed the solitude and loneliness of the season. But we are, as I've said, talking once again about Subclade K, and from the opening clips montage, those somebody's watching should have established that they have turned the notch on the fear dial up a little bit, and as you can hear or could have heard for yourself, that since our last video on Subclade K, the numbers of cases, hospitalizations and deaths have almost doubled since our last installment of Unwatchable Content, and they have also added the additional fear factor of including child deaths to this narrative. As the 1st of January dawned, the narrative for Subclade K has ramped up, and the majority of videos and articles that we are going to be seeing and reading this evening do contain news of child deaths, but we do have some other stuff to look at as well as the fear-mongering child death stories. We do actually have some fake influencers who have been introduced to the plot, as well as another few cast members and organizations entering the fray as this story does develop and grow week from week since I first started covering it back in late November. But as the new year has dawned, so too has the fear returning to the news articles, and some of the articles that you're going to see this evening, you will be able to realize and see for yourself that the echoes of the COVIDian era are beginning to ring louder and louder. Now, I'm not here again to cause any alarm. I am, as I said many times in previous videos, just reporting on an ongoing story for informative and entertainment purposes, for the delights and the titillations of the few regular offenders that tune in to these videos. But I would like to sort of point out and just sort of give you guys something to consider, and I always the message with every video that I upload, make of it what you will. If I believe it, you don't necessarily need to believe it, and just because you believe things doesn't necessarily mean to that I need to believe them. But let me just present to you a hypothetical scenario for your consideration, that let's just say if the powers to be that are orchestrating and controlling this latest psychological operation, if that's what it is, and they are looking to depopulate the world as the end result of that psychological operation, then maybe they might be incentivized to encourage as many people as possible to avoid any advice given to them via medical experts and news media outlets. So just consider that before we get into this evening's comment. And as I said, guys, always make of it what you will. But hopefully you guys will find this evening's video interesting and informative, and I will see you as always on the flip side to commence with the outro pleasantries. So sit back, buckle up and enjoy as we are about to embark on yet another journey through the avenues of alternative possibilities. So this first article came out 7 hours ago, and it is from the Chosun Daily, coming out of China or Hong Kong, I believe. But it reads, a new flu variant, Subclade K, drives over 3,100 US deaths, and the CDC reports 7.5 million cases, 81,000 hospitalizations as Subclade K spreads from the UK, Japan and Canada, and this is by Kim Yar, updated 26/01/02 at 9:31 a.m. An advertisement sign for flu and COVID vaccines installed at a pharmacy in New York is the picture we are looking for. But as a new strain of influenza rapidly spreads in the United States, a cumulative death toll has surpassed 3,100. According to AP on the 31st of last month, the US Centers for Disease Control and Prevention reported that during this winter season there has been at least 7.5 million flu patients, 81,000 hospitalizations and 3,100 deaths. And that death toll includes at least 8 children. These figures compiled as of the 20th of last month are estimated to be surpassed by the actual number of infections due to the impact of large-scale year-end events such as Christmas. And there is a stock photo of people gathering ahead of New Year's Eve in Times Square. But currently, the new influenza variant Subclade K is spreading in the United States. This mutation of H3N2, a type of influenza, a virus which first circulated in the United Kingdom, Japan and Canada before spreading to the United States. It is also spread into Indonesia within reports coming out within the last 24 hours suggesting it is going to be a problem there. And in the previous video we heard how this was causing problems in Hong Kong and had already spread to Thailand and India, as well as the above aforementioned nations. But according to the CDC report, more than half of the states have reached high or very high levels of flu-related illnesses. And this is in a matter of weeks, guys, and it is spreading extremely fast, whatever it is that is causing these people to be sick. It is taking some numbers particularly high at the moment. And the situation in some states is severe. New York State health authorities announced that during 1 week there were 71,000 flu patients, setting a record high for a single state since 2004. However, health authorities explained that it is still too early to determine whether this season's flu outbreak will reach the same extreme levels as last season. Flu seasons dominated by the H3N2 variant typically show severe patterns with higher numbers of infections and increases in severe cases. However, Professor Pecos of the Johns Hopkins University, and there is another new cast member to the ongoing narrative that is this Subclade K epidemic, super surge of superflu spanning the globe. But Johns Hopkins University are now in on the action, and he explained that it would take time to determine whether this Subclade K is simply spreading more easily or if it is more dangerous. What do you think, guys? I'm going to go for it's going to be more dangerous, but experts recommended and here we come, repeat the narrative, folks, that people should get flu vaccinations now. Even though this season's vaccine does not perfectly match Subclade K, an analysis conducted in the United Kingdom has confirmed partial preventative risks, such as reducing the risk of hospitalization. The flu poses high risk of severe illnesses, particularly for those people aged 65 or older, pregnant women, infants, and those with asthma, diabetes, heart disease, or immune-compromising conditions. The CDC and medical organizations recommend flu vaccinations for most people aged 6 months and older. And as I said, there was that article from Chosun Daily. So let's go and see what we can find next. All right, we are now at today.com, and this came out a couple of hours ago at time of recording. A new, potentially severe flu variant is spreading in the United States. Watch for these symptoms. A mutated strain of influenza A, H3N2 Subclade K, is surging worldwide, sparking concern about a severe flu season in the United States. Here's what symptoms to look for. A fast-spreading influenza is a variant that's called severe outbreaks abroad is now dominant flu strain in the United States. As holidays wind down, the virus is sickening thousands of Americans with fevers, coughs, aches, and other nasty symptoms. It's actually sickening millions of Americans if the CDC statistics are to be believed. And experts are already warning that this flu season appears to be tougher than usual, especially among young children who haven't gotten their flu shots. You dastardly, dreaded spreading children. I hope none of you die, although 8 of you have already died, and we will find out shortly that one of the child deaths didn't get a vaccine. But New York State recently set a record for the most flu cases and hospitalizations ever recorded in 1 week. Data from this US CDC show cases, hospitalizations, and deaths are rising nationwide. Fueling the majority of the infections is a new version, a H3N2, which is several mutations that may improve the virus's ability to escape prior immunity from vaccines, experts say. The mutated strain called Subclade K emerged earlier this year and quickly gained dominance across the northern hemisphere. It drove a surge of infections in Japan, which declared an influenza epidemic after experiencing an unusually early, harsh flu season. Dr. Robert Hopkins Jr., a medical director of a National Foundation for Infectious Diseases, tells Today.com. Subclade K is also sweeping Europe, fueling intense flu seasons in more than half of the region, per the World Health Organization, the WHO. The United Kingdom is facing one of its worst winters yet as a mutated strain spreads, officials cautioned in the BMJ. Subclade K has been circulated in most United States since late November, according to the Global Initiative on Sharing All Influenza Data, GISAID, and that is a database. It is now fueling an estimated 90% of cases nationwide. Knowing that there is a new mutated strain out there, H3N2 generally causes more severe diseases, and it is concerning, says Hopkins. Here's what to know about H3N2 Subclade K strain and the symptoms to watch out for. Although you guys, if you have been following along with this series of Subclade K videos as this story develops, you will probably be all too familiar with them. But the new mutated flu strain H3N2 Subclade K, there are now 4 types of influenza viruses, A, B, C, and D. Influenza A and B cause seasonal epidemics every winter, per the CDC. But the predominant strains that circulate in the United States are H1N1 and H3N2, both influenza A and influenza B. These are the 3 strains included in this year's influenza vaccine, says Andrew Pekost, a very difficult word to read, PhD, who is also part of the John Hopkins setup at the Bloomberg School of Public Health. However, the flu mutates rapidly, this individual with an unpronounceable name says, and these mutations can give the viruses an advantage. This is exactly what H3N2 did earlier this year. One strong type of H3N2 emerged that looks like it has a mutations that will evade the immunity of the vaccine, says the unpronounceable named doctor. Subclade K has 7 new mutations, which caused it to drift from the H3N2 strain into the 2025-2026 flu vaccine, the CDC says. It was first detected in Europe in June after scientists selected the specific strains to be included in this year's flu shot, said Hopkins. We think vaccine immunity won't recognize this Subclade K H3N2 virus as well. H3N2 is generally considered more severe across all ages, but especially among the elderly and young children, says the doctor with an unpronounceable name. And when we see early H3N2 activity, I think that's particularly worrisome, he adds. Will the new flu strain make for a more severe flu season? It's too soon to predict how the 2025-2026 flu season will unfold in the US, but experts are already worried about it, and it will be harsh due to the emergence of Subclade K, NBC News reported. So far this season, the CDC estimates that there have been 7.5 million cases, 81,000 hospitalizations, and 3,100 deaths in the United States.
but the real numbers could be even higher. Now, those numbers are actually pre-Christmas. We're sort of a week behind with the sort of stats that we get. So we still haven't got the figures that are going to see how much it has risen between Christmas and New Year. And I did predict in my previous video that once the New Year statistics have come in, once we've got all the figures for that week between Christmas and the New Year and we're back to normal, that we will be seeing those numbers in above 10 million. But according to the CDC's latest FluView surveillance report, guys, they've got a FluView surveillance system for the day, for the week ending December the 20th. As I was just saying, flu activity is elevated and increasing nationwide. At least 29 states are currently reporting high or very high levels of influenza-like illnesses. Flu test positively, outpatient visits and flu-related hospitalizations are all spiking. A total of 8 pediatric flu-associated deaths have been reported so far this season, and that is again coming from the CDC. The latest data from Wastewater Scan, which monitors diseases through municipal wastewater systems. Now, we heard about Wastewater Scan when that norovirus video that I also put out recently. But wastewater systems show that concentrations of flu are very high nationally. Since November, flu concentrations have increased 260%, a spokesman tells Today. Pharmacy supply chain experts told NBC News that some pharmacies are struggling to meet demand for Tamiflu and antiviral medication. So they're already starting to suggest that there may be a shortage on some of the treatments that you can get at the pharmacy that might reduce your symptoms or not make you feel as shit as you might otherwise would if you do contract influenza this winter season. But the 24-25 flu season in the US was classified as a high severity season according to the CDC. While Hopkins said we don't generally see 2 severe flu seasons on top of each other, there are no rules in this game. So it certainly is possible that we are going to have another severe season. Where is Subclade K spreading in the United States? Given that viruses don't respect borders, Subclade K has likely been in the United States for some time. Since November, sequences have been submitted to GISAID from at least 30 states. Scientists use genomic sequencing to track the spread of the new variants. A standard flu test wouldn't be able to tell you which specific strain of flu A or subclade you are infected with. So far this season, the most frequently reported flu virus are influenza A H3N2, although it says above there, look, a standard flu test wouldn't be able to tell you which specific strain of flu A or subclade of H3N2 you're infected with. But again, goes on to say, but so far, the most of them reported are actually influenza A H3N2. So I'm guessing they're using non-standard testing to figure out what specific strain is popular, but you won't get that from standard testing. Among the 275 H3N2 viruses collected from public health laboratories and analyzed by the CDC since September 28th, 89% belong to Subclade K. The agency says that the CDC does not currently publish data on the geographical distribution of the newly dominant Subclade K strain. Wonder why. As of December the 20th, the following states are reporting the highest rates of flu-like illnesses caused by all strains: Arkansas, Colorado, Connecticut, Georgia, Idaho, Louisiana, Maryland, Massachusetts, Michigan, Minnesota, Missouri, New Hampshire, New Jersey, New Hampshire, New Jersey, New Mexico, New York, North Carolina, Ohio, Rhode Island, South Carolina, and Tennessee. Is the flu shot effective against the new strain? No, it isn't. So we're not going to bother reading that, as we've already heard. It's a mismatch, and although it's not suited for this Subclade K, it might reduce the symptoms. That said, the vaccine will still offer protection, as the article says there. The flu shot doesn't always prevent you from getting infected, but it does protect you against severe symptoms, hospitalizations, and deaths. The goal of the vaccine is to reduce the severity of illness and reduce the disease's impact on our population, says Hopkins. Additionally, this year's flu shot is expected to be as good match to the H1N1 and influenza B strains circulated, but not so much against Subclade K, which is making up 90% of the cases. You'll get the protection against 2 other strains of flu, even if H3N2 isn't optimal. The flu shot is especially important for high-risk individuals, children, people over 65, and uncompromised or have underlying conditions. It's not too late to get the flu vaccine. It takes about 2 weeks for the body to build up immunity. The fact that there is a variant circulating that's a little bit different from the vaccine shouldn't in any way minimize people's desire or need to get the vaccine, says that doctor with the unpronounceable name. And here are the flu symptoms that they were going to tell us about several paragraphs ago. The symptoms of the mutated H3N2 flu strain appear to be similar to those caused by the usual seasonal flu, and the experts note these include fever, chills, body aches, headaches, extreme fatigue, congestion, runny nose, coughing. Flu symptoms tend to start very suddenly, said Hopkins. It's hit by a truck feeling, and the symptoms of flu can look similar to those caused by COVID-19 and other viruses. That's because COVID-19 was the fucking flu. They just rebranded it, you fools. And other viruses, which is why testing is important, even though they have gone to say that they won't be able to determine what specific flu strain you are infected with standard testing. They are saying testing is important. I'm just pointing out those contradictions there. There are now 3-in-1 rapid home tests for influenza A, influenza B, and COVID-19. These experts recommend stocking up if you can, not just go and get one, stock up. You're going to need plenty is the message that is sort of being said without being said there, I'm guessing. But if you test positive for the flu, you can seek treatment with antivirals, which we've heard in concern of supplies running low, which can reduce symptom severity. Hopkins says in most cases the flu will resolve on its own without treatment after 5 to 7 days. If your symptoms are severe, you have a high fever, signs of dehydration or trouble breathing, contact a healthcare provider right away. The flu is not just a cold, it can be quite severe. How to protect yourself from the flu during a respiratory virus season. People can take simple actions to protect themselves and others, and the expert notes: stay up to date on vaccines, test if you have symptoms. If you're positive, stay home until you're fever-free for 24 hours without medication and your symptoms are improving. If you don't have a fever, stay home for 5 days after symptom onset. Avoid sick people. Wear a mask in crowded indoor spaces. And wash your hands frequently. Don't forget to cover coughs and sneezes. These small things can make a big difference if we all sort of pitch in and think about our community, says the doctor without an unpronounceable name. And that's a little bit like saying we're all in this together. So there you go, guys. There was a slightly longer article from today that did really sort of repeat mostly what we have been hearing in almost every single article so far in this series of videos as we are following this developing story about Subclade K. So we're gonna give you guys a break from the articles and give you a bunch of videos, and when we come back we are going to be hearing about some child deaths as a result of this super flu variant Subclade K. And I did give you a spoiler alert: one of the child deaths wasn't vaccinated.
Health check here at 5 o'clock. A new flu variant is sweeping across the U.S., sickening millions, and a surge doctors say may not end for weeks. Flu activity is at high or very high levels in 32 states, including New Jersey, that according to the CDC. And that's an increase from 17 states reported in the previous week. The agency says since the flu season began in October, at least 7.5 million people have contracted the illness. Hospitalizations nearly doubled in just the last week. Health experts say the new variant, called Subclade K, may be better at dodging immune systems.
Hospitals in the Bay Area are reporting more influenza-like illness, pointing to a mutation in the strain.
There's this, mutation seen in this H3N2, which is why it's gotten its own name under Subclade K is kind of the other medical terminology. But I think the worry is that is there enough mutations in this virus, which we see influenza do. It tends to what we call drift into kind of new versions of influenza, which, when there's enough mutations, we worry about the vaccine efficacy.
The CDC estimates that there have been at least 7.5 million illnesses and 3,100 deaths from flu this season so far. That's up from 4.6 million illnesses and 1,900 deaths just last week. So is this strain worse than the one that we saw last year?
I think time will tell. I don't think we know for that right now. I think there has been a lot of alarm in different countries. In, Japan and United Kingdom, there's been more cases earlier on in the year. So I think that's what's gotten people alarmed.
In Santa Clara County, wastewater is giving this region a glimpse into the uptick of cases.
We're seeing an increase in influenza concentrations in the wastewater, which signifies that we're seeing spread of influenza in our community. We're also seeing increases in emergency department visits due to influenza and hospitalizations.
Our data team confirmed the overall hospitalization rate in the Bay Area is a little over 2 people per 100,000 residents. The number is slightly higher in Santa Clara County.
The Subclade K does belong to the H3N2 strain. And anytime we have an H3 predominant flu season, as opposed to, say, an H1N1 predominant season, we tend to see more severe impacts.
Medical experts are recommending to still get vaccinated to prevent severe illness, especially those over 60 years old and young children. And ask your doctor about an antiviral medication.
When you take that medicine, it shortens the length of your illness.
And the biggest worry is that this flu strain could lead to more severe disease. Dr. Rubio said hospitals are reporting infections in the lungs and some inflammation of heart tissue associated with this strain. The prediction is for this flu season to end anywhere between April and May. Emma?
This is a look at the CDC's weekly flu surveillance report. Now, the report shows flu cases remain high in the southeast, including right here in Alabama. And just this week, a 14-year-old from DeKalb County and an 11-year-old from Hueytown died from flu-related complications. LA 31's Jim Abbott takes a closer look at what's causing this flu season to be so rough.
Well, Demetria, the CDC attributes the high number of cases to a variant, Subclade K, which is spreading across the country. I talked with a doctor at the Hartsville Health Park ER, and he concurs.
Dr. Ryan McMorris says in Hartsville, they're now seeing dozens of flu patients a day. They don't genetically test for the specific virus, but he suspects the majority of their patients have the H3N2 Subclade K variant flu. That strain was identified in August after scientists chose the strains to include for this year's flu vaccine. It's unclear if this strain is more dangerous than other strains. Dr. McMorris believes it's just more contagious.
So the more spread you have of a virus, the more likely harm will come from it. So the cases we've seen here aren't like they're as severe as cases we've seen the year before, as much as just more people are catching it. So the more people that catch a virus, the likelihood of someone having a harmful reaction from it or getting really sick from it is higher just because there's more people catching it.
Hartsville's ER was already seeing an uptick in patients in mid-December. Those numbers shot up again the day after Christmas.
Over the last couple of weeks, we've seen double or triple our usual numbers in flu-like illnesses, and the volumes have gone way up in the ER.
Dr. McMorris says for most people who come down with the flu, ibuprofen, chicken soup, and rest still the best home remedies to get you back to normal. But if you catch this strain and it really does pack a punch, at what point do you set the normal care aside and decide it's time to get some serious medical help?
Yeah, you're feeling like death, you're not breathing good, you're not eating good, you're feeling weak and dizzy, you just come see us in the ER, we'll take care of you.
Now, keep in mind the Hartselle ER is still relatively new and they have a lot of room for patients there. If you want to wait in Huntsville or Madison, well, your wait is going to be much longer. Add to that, work and school back in full force next week, and doctors are expecting another surge in those flu cases. Live in studio, Jim Abbott, Wave 31 News.
The cold weather will keep people indoors, hopefully, and safe. But this comes at a time when a new strain of the flu is filling urgent cares in hospitals throughout the country. An 11-year-old Alabama boy, Jace Watkins, died over the weekend after battling a severe case. WEAR's Melanie Levy joining us now from outside the emergency department at Ascension Sacred Heart Hospital. And Melanie, healthcare experts say there is a new flu variant that's going around.
Stu, that's right. It's called Flu A Subclade K, and chances are you or somebody you know might have had it within the past couple of weeks. Jace Watkins was a 5th grader at Hueytown Intermediate School in Alabama. Reports indicate he first showed flu-like symptoms on December 18th. Just 2 days later, he was rushed to the hospital in Birmingham after he had a seizure and stopped breathing. Watkins spent nearly a week in the ICU, ultimately passing away Saturday night from complications from the flu. His aunt, Sabrina Parsons, shared her grief in a social media post, writing, quote, "Jace never even got to open his Christmas gifts. What do we even do now? This will forever weigh over our family." Doctors warn this flu season is worse than it's been in years. That's partially due to what they're calling a new super flu.
It appears to be this new variant, Subclade K, it's an influenza A.
Dr. Susan Langer is the director of primary care services for Sacred Heart Medical Group.
It's going to have the exact same flu symptoms as flu has in the past. In general, what we know and understand is that when people get the flu, they can come down kind of feeling ill pretty suddenly. Things like headache, fever, body aches, and the K, Subclade K, we believe that it is another flu. It seems like there may be increased transmissibility, so more people are getting it, and certainly that's what we've seen.
Nationwide, the CDC estimates there have been at least 49,000 hospitalizations and 1,900 deaths from the flu so far this season. The majority of these flu illnesses are being linked to Subclade K. Bonnie Reland, the chief clinical officer at Health and Hope Clinic in Pensacola, says this new variant can lead to further complications.
Sinus infections, ear infections, some people end up getting, COPD exacerbations, or they'll get a real nasty bronchitis or even pneumonia, and some hospitalizations, unfortunately, but.
And those all can stem from the flu?
Mm-hmm. Wow. Mm-hmm. Absolutely, yeah. And I know just from kind of the statistics at the county, it's definitely being reported more with the emergency room visits and things too.
Their advice, getting your yearly flu shot, washing your hands constantly, and even taking Tamiflu, which is effective against Subclade K. Now, doctors say if you have any trouble breathing, any chest pains, or shortness of breath with your flu, you should absolutely go to your nearest emergency room. Live in Pensacola, I'm Melanie Levy. Back to you, Sue.
We are now at gizmodo.com, having just saw a video in the previous newsreel talking about a child that lost its life as a result of contracting Subclade K, this super flu mutant virus. This article says the super flu is hitting kids hard, dramatic pause, and some aren't surviving. Maybe I should try and read that a little bit like Arnold Schwarzenegger. The super flu is hitting kids hard, and some aren't surviving. I don't know why I chose to read it like some Arnold Schwarzenegger. Maybe I thought perhaps it would provide a little bit of a comic relief, although there's nothing really funny about child deaths. But several states have reported their first pediatric flu deaths this week, and this is by Ed Cara, published January the 2nd, 2026. This came out about 2 or 3 hours ago at time of recording, and there is a 3D illustration of flu virus particles. There you go, scary graphics for you folks. Where have we seen those before? The influenza season is in full swing, and it is already proving to be deadly for some of the most vulnerable Americans around. Dramatic pause and shock its children. Several states have reported their first pediatric flu deaths this week. Cases and hospitalizations are rising across the country as well, while some areas are experiencing record level surges of illnesses. The season is being driven by the emergence of an unexpected strain that we know all too well about, Subclade K. But this is the part that we really need to get to, the tragic deaths due to the holidays. The most current flu data from the CDC and the CDC is nearly 2 weeks old, yet it is still evident that this season is gearing up to be a nasty one. And as of December the 20th, the flu activity was high or very high in 32 regions of the United States and in moderate in 8 other jurisdictions. The cumulative flu hospitalization rate in week 51 was also the third highest it's been at this point in the past 15 years. The 2022, 23 and 23, 24 seasons were the other two. It says here in a box, NYC is getting hit hard by the super flu, and the worst is yet to come. Read more. Maybe we'll come back to that, or maybe we won't. Things have been even worse for some states. Last week, for example, New York health officials reported experiencing the largest weekly surge in flu cases ever recorded in modern history. If or not that should be cause for alarm is up to you. But it is a little bit concerning if it is the highest ever in recorded. And again, we still haven't got those figures from the weeks between Christmas and New Year and the week after New Year. So I'm sure they're going to be raking more records before we've heard the last of Subclade K. And for some folks, they already have heard the last of Subclade K, as it was Subclade K that unalived them. But there were these record-breaking flu cases, 71,123 positive flu cases during the week of December the 20th. Now, at least 8 pediatric flu deaths this winter have also been recorded by the CDC so far, though local health officials and members of the public have documented more since. So these are the only ones on record, but there have been further child deaths that have been documented but haven't made it to the record yet. On December the 30th, for instance, the Kentucky Department for Public Health reported its first pediatric flu death of the 2025-26 season. A child from Kenton County who did not receive a flu vaccination. The next day, the Ohio Department of Health, ODH, reported its first pediatric flu death, which involved a teenager from Greene County. And on Thursday, Paul Kim, a popular social media influencer and Minnesota resident, announced that his 5-year-old son had also died after contracting a severe bout of flu. We're actually going to read an article all about him next. His death, this death is tragic, and our hearts go out to the family, said Bruce Vanderhoff, a director of the Ohio Department of Health, in a statement. It also reminds us that influenza, though common, is a serious health threat, and we urge parents to protect their kids. A record bad winter. Even during a typical winter season, flu will sicken millions of Americans, hospitalize hundreds of thousands, and kill tens of thousands. But it's certainly possible that we could be in for 2 straight bad seasons in a row. Last winter, at least 280 children in the United States died of the flu, which is the highest death toll in children for a non-pandemic flu seen in modern history. There is an article we probably will come and read once we got to the bottom of this one. More kids are dying from seasonal flu than ever. This season is being fueled by the emergence of Subclade K, a variant noticeably different on the genetic level from flu strains scientists predicted would be circulating this season. Since its arrival towards the end of the winter in the southern hemisphere, K has quickly taken over as the leading cause of flu cases worldwide, including in the US, though the variant doesn't appear to cause more severe infections on average than other H3N2 strains, it has caused strong, early or prolonged waves of illnesses in various parts of the world, including UK, Japan and Australia. Though the seasonal flu vaccine is a mismatch, we're not going to read that, we know all about it. Let's click on this one here. More kids are dying from seasonal flu than ever, and this is actually from back in October 6 of 2025. So even before the sort of influenza Subclade K super variant started running rampant, they were already reporting that the seasonal flu is without a doubt back, and it is killing more children than ever. New data from the CDC and the prevention shows that reported child flu deaths reached a record high last winter, and the CDC experts laid out that the sobering data in the paper published late last month that we just heard in the previous article, that 280 children died of the flu during 2024-2025 season, the highest such toll recorded since modern tracking began 2 decades ago. It's the second straight winter that pediatric deaths have reached a record peak, which may not bode well for this upcoming season. And again, this was from October, just before word of Subclade K on the rise had broken, and they were predicting that it could be worse this summer, and lo and behold, we're already hearing that there have been 8 pediatric deaths so far, and one of them was an individual that hadn't had his flu shot. But the seasonal flu, like many infectious disease, took a hiatus during its first years of the COVID-19 pandemic. Of course it did. It just decided to go away and let COVID have its thing. You know what? We have fun every year, influenza strains. Let's have a sabbatical and let our buddy COVID go and have some fun and see what he can get up to while we're chilling and relaxing and mutating. I don't know if that's what sort of conversations viruses would have with each other, but hypothetical alternative avenues of possibility, alternative realms, an alternative universe perhaps. But the same measures are taken to reduce the spread of pandemics such as social distancing, also substantially reduce transmission of flu and other garden variety germs. But as the world returned to normal, so too did diseases like influenza. It was because we socially distanced and isolated, and that's what they're saying. There is why there was no influenza deaths during the pandemic for COVID-19. But the deaths begin to climb back to their usual trends during the 22-23 season. But last winter's flu was one of the worst ever recorded in modern history, and I'm going to guess and place a very small non-bet that this year is going to break last year's records, and there's probably going to be a lot more kids that pass away this flu season than last flu season. If you're watching in the live premiere, pipe up with your thoughts and opinions in the comments now. If you're watching subsequently, love to hear what you have to think. It was the first high severity flu season for age groups documented since 2017-2018. Hospitalizations rate was the highest recorded since 2010-2011 season. Between 27,000 and 130,000 flu-associated deaths occurred based on the CDC's preliminary estimates. Since 2004, doctors and hospitals have been obligated to report any child deaths linked to the flu to their local health departments. This then allows the CDC to directly track US flu deaths in children for any given season. The 280 pediatric deaths seen last winter are the highest toll recorded in modern era, and only slightly below the 288 deaths seen during the H1N1 flu pandemic of 2009-2010. Nearly all of these deaths occurred among unvaccinated children, making up 89% of the deaths, while about half happen in children with no pre-existing health conditions. A sign of things to come? Of course it is, as we are already discovering that the strength of this upcoming flu season will depend on many factors, including the inherent severity of the flu strains calculating around the world. But there are already reasons why we should be worried about how hard next winter's flu will hit children and adults for that matter. For starters, the flu vaccination coverage was lower for children last winter than it was previous flu season, and in fact the flu vaccination rate in general has been sliding compared to before the pandemic. Americans are already sick of RFK, as a clickbait there, we're not going to read it, but the anti-vaccination movement, which is controlled opposition, and they did provide a lot of narrative and rhetoric for that controlled opposition anti-vaccination movement, things like do not comply, don't wear a mask, sheep, COVIDiots and all that kind of stuff. That was all state provided, folks. None of that was organic. The anti-vaccination movement has also reached new heights of power thanks to the installation of figures like R.F. Kennedy Jr. in the Trump administration. Again, you need your ambassadors, you need your endorsers, and you need famous public figures to be on either side in order to, as I said, lead the charge and often provide narratives that will be repeated over and over within those movements. But less than a year's time, RFK Jr. and his allies have succeeded at removing or weakening several childhood vaccines based on shoddy evidence, and they continued to promote their widely debunked link between vaccines and autism. Most Americans do still support vaccines generally, and Kennedy has continued to quietly endorse the seasonal flu vaccine for children and adults. For now, at least in brackets, but his policy changes in public podium could certainly increase vaccine hesitancy for the flu shot and others. Seasonal flu vaccines aren't 100% effective, as we're hearing in every single article we've read regarding Subclade K at preventing infection, but they have and will remain highly effective at preventing the worst outcomes of flu, including severe illnesses and death. So if children and their families aren't getting vaccinated against the flu, it may not take long to reach another record high in flu deaths. The article finishes up in saying, and again, no mention of the variant Subclade K in this article from back in October, reporting that more children are dying than ever from seasonal flu, and it sort of forewarned that this winter could be a bad one, and this was even before we knew about Subclade K. So do they know something we don't, and are they sort of providing us and preparing us for what's to come with these news reports? But as promised, let's go and hear about that influencer's 5-year-old who also died over the Christmas period after contracting this mutant variant Subclade K influenza strain. So this article is from foxnews.com, and it come out the 1st of January 2026, so just over a day old. Influencer's 5-year-old son dies after 11-day flu battle, and it was followed by 1,000. The tragic death comes as a new, highly contagious and aggressive superflu strain has been sweeping the nation. By Emma Busey, Fox News. And as I said, come out 8:36 p.m. on the 1st of January 2026. There is a video there, and you can actually listen to this article if you so desire. Should we try and do that? Let's do it.
Catholic influencer's 5-year-old son dies after 11-day flu battle followed by thousands. A Catholic influencer announced Thursday that his 5-year-old son had tragically died after an 11-day battle with a severe case of the flu, a loss that unfolded publicly as he shared updates almost daily online. Paul J. Kim, who shares faith-based content with more than 300,000 followers on Instagram, said his son Micah died on New Year's Eve. In an emotional video posted Thursday, Kim thanked supporters for their prayers and asked for privacy as his family grieves. "We are so proud of him," Kim said in the video. "I want to thank you from the bottom of my heart, as his dad, on behalf of my family, for all the ways you guys prayed and lifted us up during this time. It's been the hardest thing I've ever been through in my life, and it continues to be." Kim first shared news of Micah's illness on December 21st, when he posted that his son was being taken to the hospital by ambulance following a medical emergency. In subsequent updates, Kim said doctors described Micah's illness as an unusually severe case of the flu. Kim later told followers that Micah had been placed on life support and urged people to pray. In later updates, he revealed that the flu infection had turned septic and triggered seizures. At the time, Kim said doctors described the case as rare and extremely serious. In a December 30th update, Kim said his son's condition had worsened and that Micah was in a coma as doctors and family members worked to give him as much time as possible. Kim's posts, some of which showed Micah in the hospital, were viewed millions of times as the tragedy unfolded. Throughout the ordeal, Kim referred to his son as a fighter and my hero. In a written Instagram post, he quoted Job 1 verse 21, "The Lord gave, and the Lord has taken away. Blessed be the name of the Lord," and said Micah had entered the never-ending glory, love, and peace of God. He added that while his family's hearts are broken, they continue to rely on their faith. Kim also asked followers to pray for his family as they learn how to live by faith and not by sight. According to recent data, the CDC reported 288 pediatric deaths in the 2024-25 season. This has been a record high for a non-pandemic year, mostly among unvaccinated kids, with 70% having underlying conditions like asthma. In addition, a new so-called super flu strain has emerged this season, a mutation of influenza A H3N2 called Subclade K. It's highly contagious and aggressive, and is sweeping the nation this season. On average, around 20,000 children under 5 are said to be hospitalized annually, with younger children under 6 months facing the highest mortality risk, highlighting the importance of annual vaccination, according to the CDC. Kim did not immediately respond to Fox News Digital's request for comment. Fox News Digital's Angelica Stabill contributed to this report.
Well, thank you, AI, for reading that, and without wanting to upset anyone. And before I do say what I'm about to say, do be aware that not everybody has the same belief system or share the same faith as you, but so much for the prayers. Didn't amount for absolutely anything. And what a bit of a deluded, poor, misguided soul here that was sort of glad that his son died because now he can be in the never-ending glory of love and peace. Then why did they bother praying for him? Why didn't they just let him die if he was going off to heaven? And maybe it was God's will that he contracted flu. And how arrogant of humans to try and change the will of God by begging him to save the son that possibly God had deemed worthy of death. And God does have a lot of infanticide on his hands. Just ask the firstborn sons of Egypt. But as I said, guys, I don't mean to offend anybody. We don't all have the same faith. But it just goes to show that this disease, Subclade K or whatever it is that is running rampant in the United States, doesn't care whether you are of faith-based or not. It probably doesn't care what faith you are at all. As we've heard there, the prayers, they did nothing to save that poor child. And so let's go and watch a few more videos, and we'll come back with possibly a couple of articles more before we think about wrapping things up.
Sacramento County health officials have confirmed the first influenza-related death of the season, and that patient is a child. Health officials say the child had no underlying medical conditions and died from complications of the flu. The Sacramento County Department of Health Services warns while most people recover from the flu within days, younger children, older adults, pregnant people, and those with chronic health conditions face a higher risk of serious complications, including pneumonia and death. Health officials urge families to take the flu symptoms seriously and seek medical care if symptoms worsen. They ask to take precautions like washing your hands, especially during this holiday season.
A teenager has died from the flu. Greene County officials confirming the death was the first in the state in this year's flu season. Tonight, Brady Williams spoke with the victim's family.
This happened in Greene County, not far from Dayton at all. We're told that Riley was just 16 years old when this happened. Her family wants people to understand just how serious this flu can be.
And Riley, she loved, anyone she met, she would make them feel on top of the world. Even when Riley didn't feel on top of the world, she wanted you to know how beautiful you were, how loved you were, and she meant it.
Riley Spurlock was 16 years old. Sister Kylie and stepmom Brittany say she was incredible.
I found peace knowing that my children had a sister like Riley, and it just feels like a piece of me. And, my children will never have that back.
They say Riley was Ohio's first pediatric flu victim this year. Riley did not have a flu shot this year. Her family says last Tuesday she went to the doctor with ordinary flu symptoms.
The doctor told us that it was going to get worse before it got better.
On Sunday, it was clear she was much worse.
She was coughing and choking on her own blood.
They say at the hospital she quickly deteriorated.
She went from a 98.5 temperature to a 105.
She went septic.
She double pneumonia, all within 24 hours, and it just all from the flu, and it doesn't make sense.
They say doctors offered to put Riley on an artificial heart and lungs. They consented, but an hour later, doctors returned with horrible news.
Riley had a pulse for 50 minutes, and they were doing chest compressions, and she was brain dead.
What do you want folks to learn from this?
I want people to know that this is not just a flu. I want parents to be overbearing. I want them to know signs of what's good and what's not. Sepsis, it gets you. I want to be able to save somebody since my sister wasn't able to be saved herself.
It's not keep your kids inside. Oh, they're healthy. No, she was healthy and now she's gone.
Doctors, of course, are recommending that you wash your hands and get your flu shot. For more information and more of our coverage, head to fox19.com. For now, Brady Williams, Fox 19.
The super flu is here, and it's wreaking havoc across the nation.
It seems like everyone is getting the flu. The Centers for Disease Control report cases spiking.
What we're seeing right now is a very rapid escalation in cases.
So far, 7.5 million cases of the flu have been reported, resulting in 81,000 hospitalizations and 3,100 deaths. New York State just experienced the highest number of flu cases ever recorded in a single week.
And it feels like I'm dying.
Symptoms include fever, cough, headaches, runny nose, fatigue, muscle aches, and chills. Those stricken with the super flu are taking to social media, warning everyone just how bad it is.
I've never been this sick. My eyeballs felt like they were actually going to explode.
Anna Gross, who is 20 weeks pregnant, ended up in the hospital.
They were packed. I'm talking the ER was slammed. Everyone was coughing. Everyone's masked up. I was talking to the nurse that was handling my breathing treatments and stuff, and she said that the flu has just ransacked the hospital.
The super flu variant originated in Europe, and we're hearing reports of voluntary health checks at airports in the USA for international travelers.
The super flu outbreak has many Americans rethinking their plans for New Year's Eve.
Literally freaking out. Are we going out on New Year's Eve?
There's good reason to be cautious. Just released numbers from the CDC show a surge in flu cases. It's prompting some to pull the plug on the celebrations.
Your girl is staying in, so thank you for the invite, but no thank you.
There are precautions you can take to avoid the flu.
Wear a mask if you're going to be in crowded public places. I recommend always washing your hands, especially before touching your face.
New Year's Eve, kissing at midnight, is that allowed this flu season?
I mean, I don't want to stop anybody from having a good time, but if you're worried that somebody that you're close with is coming down with something, I probably would save that kiss for when they're feeling better.
If you are exposed to the super flu, you can take antiviral medication like Xofluza or Tamiflu before you have symptoms. And what about those over-the-counter remedies like a saline rinse or a gel spray for your nose? Doctors say they may not stop you from getting the super flu, but they can help alleviate symptoms.
New Year's Eve, if you want to go out, you just need to understand there's always going to be risk of infection out there, particularly New Year's Eve when people are drinking. Your immune system defenses go down. So you want to be cautious and you want to understand what your risk is.
Flu activity is surging nationwide and here at home. So far this flu season, the CDC estimates there have been at least 7.5 million illnesses, 81,000 hospitalizations, and over 3,000 deaths. Reporter Rachel Williams joins us now in studio breaking down what we're seeing here in Florida. Rachel?
Jade, in the latest data from the Florida Health Department, it says flu emergency department visits and the flu positivity rates are increasing. 3 counties are seeing increased flu cases. Those counties are Palm Beach, St. Lucie, and Indian River, while Okeechobee is decreasing and Martin County is not changing, according to the Health Department. It's important to note that the Florida Health Department and the CDC's data is delayed. These statistics ended on a certain week in December, which means it is likely that current levels are higher. We'll also learning genetic testing indicates a new flu variant called Subclade K appears to be behind the vast majority of cases in the U.S., but doctors say there is one predominant strain on the rise.
Flu is always made up of several different subtypes of viruses. We have one this year that's a bit unusual. It's called H3N2. It is associated with just more severe illness, and we're seeing a lot more people get infected.
The Florida Health Department says getting your annual flu vaccines are the best way to protect yourself and others from potentially severe flu complications. Experts say flu shots take up to 2 weeks to become fully effective. Rachel Williams, WPBF 25 News.
New data just out today from the CDC shows just how bad this year's flu season really is. And the bad news is that it is not slowing down right now. The CDC says there have been at least 7.5 million cases so far just this season. That includes some 81,000 hospitalizations and tragically more than 3,000 deaths. Unfortunately, all of those numbers are trending upwards. Joining us, founding director of Boston University's Center on Emerging Infectious Diseases, Dr. Nahid Badilia. Doctor, thank you so much for joining. So take us inside this new data that we just got from the CDC today.
Yeah, Antonia, I think what's worrisome is that we seem to always have this bump after the holiday season, and seeing the speed with which cases are increasing kind of makes us worrisome for a year with a heavier flu season. And 2024 was actually the worst flu season we've had in a decade. So seeing this grow this way is worrisome for the healthcare burden that we may see. I will say what's driving this is a new variant called H3N2 Subclade K, which has already been causing earlier flu seasons, more severe flu seasons in Asia and UK. So we're seeing that now here.
So does the available flu vaccine that everyone was encouraged just a few months ago to get, does it protect us at all against this strain? And is it worth getting right now if you haven't already gotten the shot?
Yes, yes, and yes. It protects, even though it's not the best match in terms of the yearly matches that we see, because the variant actually came out after the composition of this year's annual influenza vaccines were put together. But UK's data shows that particularly in kids, it's protective against hospitalization to up to 80%, and adults is about 30 to 40%. So you may still get sick, unfortunately, but you want to have those in your arsenal to prevent against severe disease and hospitalization. And particularly now as cases are increasing, getting it now before you head back to work is going to provide protection in the new year.
And how are our health systems doing in handling this massive surge? And I mean that from the local level, rural, urban communities, but also all the way up to the federal level at a time when we see people being increasingly hesitant to get vaccines. There's mis and disinformation out there, sometimes spread from the very top. Do you think that's complicating matters?
Well, let me start from the bottom up. I think what we know annually, even when it's not a bad season, influenza and respiratory viruses cost the U.S., whether it's direct medical or all-inclusive costs, somewhere between $50 to $100 billion annually. So if you have a rough year last year and you might have another rough year this year, it goes beyond just the burden on the healthcare systems. You may see this roll over into people's everyday, right? And I know not everybody may have this capacity to do this, but as you're thinking about going back to work in the new year, if you're sick, stay at home if you can. That's going to help decrease the transmission. In terms of the work around the federal government, the CDC recommends this influenza vaccine to everybody, with the rare exceptions of some medical conditions. Everybody over 6 months should get this vaccination. And that's even the current CDC under Secretary Kennedy actually recommends that. So I would suggest people actually block out a lot of the misinformation is out there and hear what the public health experts are saying around the protection of a vaccine that we have so much experience around.
So you mentioned people heading back to work, but what other advice do you have for people who, are riding public transportation, have to travel in the next couple days, or have kids who are going to go back in school in tight quarters with other kids? What can they do right now?
Again, one of the major things that you can do is get vaccinated. If you're sick, stay at home. And it's a very personal choice. But when I travel, I will once again say it is a personal choice. You should wear a mask if you're concerned about potentially getting exposed to others who may also be traveling who are sick.
Dr. Nahid Badilia, great to have you. Thank you so much for sharing your expertise.
Next up, the independent.co.uk. A child death toll rises from flu in the United States as surging cases have some states breaking grim records. Hospitalizations have nearly doubled from 9,944 to 19,053 from the week of December the 13th through to the week ending December the 20th. Again, this come out on the 1st of January 2026, so the first day of the year seemingly was when they were dropping the child death stories to the narrative that is ongoing regarding Subclade K. The child death toll from flu rose again this week as cases of super flu continued to surge across more than a dozen states. The nationwide tally ticked up to 9, so that's one more from what we previously heard that was reporting of 8. So another one to the mix, with health officials in Ohio and Kentucky reporting their state's first pediatric flu deaths. The Ohio Health Department said an unidentified teenager in Greene County had passed away following an infection. It was unclear if the teen had been vaccinated for the flu, highlighted in red there, but the department stressed the importance of getting a flu shot. It's not too late to get a flu vaccine. It could prevent you or your loved ones from getting seriously ill, said Ohio Department of Health Director Dr. Bruce Vandervoff, who we've heard from before. But officials in Kentucky said a child who had passed away from the flu in Kenton County had also had not received his vaccine this year, and the Kentucky child has also not been identified. And there is a photograph of people in New York City wearing masks back in March of 2020, so not recent, but I told you guys, echoes of the pandemic are ringing louder and louder. But this is heartbreaking reminder that the flu is not always a mild illness, especially for young children and people with high-risk medical conditions, said Dr. Stephen Stack, who is an SS. Look, lots of SSs floating around in contemporary times in some of these nefarious agendas. But the security of Stephen Stack is the security of the Cabinet for Health and Family Services at Kentucky Department for Public Health. Centers for Disease Control and Prevention recommends that everyone over the age of 6 months old gets the annual flu shot to prevent serious illness. The announcements come on the heels of the deadliest non-pandemic flu season for US kids on record and the worst flu season in nearly 15 years last year. This year, the agency estimates that there have been 7.5 million infections and more than 81,000 hospitalizations and over 3,100 flu deaths across the country. Hospitalizations have spiked rapidly, nearly doubling from 9,944 to 19,053 from the week December the 13th to the week of December the 20th. A map from the CDC shows the current hotspots. I don't know why we can't see the map, but New York is facing one of its worst flu seasons ever, with officials reporting a new high in week-to-week cases before Christmas, up by 38% according to WNBC. We are seeing the highest number of flu cases ever recorded in a single week in New York State, said Health Commissioner Dr. James McDonald. In the West, Colorado is seeing a record number of hospitalizations, with nearly 800 people now hospitalized with flu, according to the CPR News, and that was up by 250 by the previous week. The 782 new flu-related hospitalizations reported from the week ending December 27 is a record for raw numbers of influenza hospitalizations. So this is breaking all kinds of records, folks. But it's for raw numbers of influenza hospitalizations reported in 1 week since we started tracking influenza hospitalizations in 2004. Hope Schuler, a spokesperson for the Colorado Department of Public Health and Environment, told the outlet in an email, and I guess there is the map, but we have seen this map in various forms in several of those news reels, but there is a thing confirming that there is a map from the US CDC showing the activity and hotspots for this latest influenza mutant strain, Subclade K. We saw a similar rate of hospitalizations, 40 per 100,000 during 24-25 season, but that figure wasn't reached until roughly 4 weeks later into January. So these figures this year are spiking and already sort of higher than they were at the season's peak last year, before this sort of season's influenza season has really rolled into town. It is sort of these figures and all these numbers that are very alarming and constantly rising are sort of premature. The sort of flu season doesn't really kick in until sort of the end of December, early January, and as we've heard, can go on to sort of April or May in the northern hemisphere. So this is why it's alarming that it's sort of already peaking and breaking records before flu season really has officially started. But the majority, back to the article, of cases are tied to hospitalizations in Colorado, New York, and elsewhere are due to Subclade K, and associated, and H3N2 is often associated with more hospitalizations and deaths in older people. Although we're not hearing about deaths in older people, we're hearing about deaths in children. So it is also emerged widely after flu vaccines were finalized for the season, leading to the fears that it couldn't be effective. We know all of that. It's not very well aligned, which means there is potentially a larger proportion of the population that is susceptible to the flu. Neil Maynard, the director of Master of Public Health Program in the Northeastern University, said in December, still getting the vaccine is important to prevent serious illnesses, he noted. More than 130 million American adults, or about 42%, have gotten this year's flu shots, with the 2025-2026 flu season far from over. It's hardly just begun, or as the Carpenters would say, it's only just begun. Sorry for that. But this season typically runs through the spring, and last year saw cases peak in January and February. By the end of the season, there were tens of thousands of flu deaths, including 280 children. Right now, it's too early to tell how the US will fare this season. Severity indicators remain low at this time, but influenza activity is expected to continue for several more weeks, the CDC says. And that is the end of that article. So let's see and head over to our next article. Right, this one comes from medscape.com. Early intense flu across Europe as Subclade K dominates, and this is January the 2nd, 2026. The flu epidemic in Europe is intense and expected to peak in early January. This surge, which is overwhelming emergency departments and at times prompting authorities to requisition physicians, is occurring across much of Europe, the World Health Organization has said. The flu season has begun roughly 4 weeks earlier than in previous seasons. As I was just saying in the previous article, the WHO noted at least 27 of the 38 countries in the World Health Organization European region are now seeing high or very high influenza activity. So this isn't just isolated to the United States, folks. It is also running rampant in Europe. And it is seeking European region are now seeing high or very high influenza activity in 6 countries: Iceland, Kyrgyzstan, Montenegro, Serbia, Slovenia, and the United Kingdom. More than half of the patients tested for influenza-like illnesses were positive for influenza. A new strain we know all about is Subclade K, and the flu comes around every year, but this year it's a little different, said Hans Henry P. Golge. Hans Henry, I think we've heard from him in a previous video. But the WHO regional director for Europe, a new strain of Subclade K is driving infections, though there is no evidence that it causes more severe diseases. This new variant of seasonal flu now accounts for up to 90% of all confirmed influenza cases in the European region. It shows how even a small genetic variation in the flu virus can place enormous pressure on our health systems because people do not have built up immunity against it. A similar picture is being observed in France, according to Santé Publique France and the Institut Pasteur. Influenza virus detected most frequently is type A, known for its virulence, but we are finding several subtypes among the samples tested: A3H3N2 Subclade K and A H1N1 PDM09, said Vincent Enouf, who is the deputy of head at National Reference Center for Respiratory Infection Viruses at the Institut Pasteur in Paris, France. Again, the question is the vaccine effective? While it can't prevent all infections, early data from the UK indicate that the current seasonal flu vaccine reduces the risk for severe complications. Yada yada whoopie woo ray-tay-tay. The European Centre for Disease Prevention and Control, ECDC, not ACDC, ECDC, the EU's disease control agency, reported that preliminary data from multi-centre primary care study in the vaccine effectiveness, burden and impact studies, VIBIS is the acronym for that, show that seasonal vaccines available in the EU offer protection against A3N2 infection with vaccine effectiveness between 52 and 57%. VIBIS is ECDC's network assessing influenza vaccine performance in real-world primary care. The WHO and the ECDC reiterated that vaccine remains the most important preventative measure to avoid severe complications, particularly for people at high risk, including older adults and those with underlying conditions, pregnant women and children. The WHO also encouraged health professionals to get vaccinated to protect themselves and their patients. The current flu season, though serious, does not represent the level of global emergency we faced during the COVID-19 pandemic yet. Clerge said. He didn't say yet, I added the yet. But our health systems have decades of experience in managing influenza. We have safe vaccines that are updated annually. But we've heard in every single article, although it has been updated for this year, it wasn't updated in time to include Subclade K, which is showing it is very resilient to the immunity provided by the vaccine and very deadly to those that have not been vaccinated, as we heard was the case with that unidentified teenager from Kentucky. But if we use the proven tools that we already have, vaccination, health consciousness, behavior, and strong public health systems to protect the most vulnerable, then we will weather this predictable seasonal storm. With the year-end holidays approaching, consistently adopting protective measures is essential to slow the spread of respiratory viruses and protect those at the highest risk of severe disease. And that is that. So let's go and check out a few more videos, and we will come back and look at some more stuff, although it may not be articles per se, but I did want to sort of show you something else that has sort of developed within the last 24 hours at time of recording, but over on YouTube at this time and not a search engine.
New this morning, a child has died from the flu virus in northern Kentucky. According to the State Department for Public Health, the child was from Kenton County and did not have the recent influenza vaccine. Officials say this is the first pediatric flu death of the season. According to officials, the best protection against the virus is a flu shot.
Another child has died as the flu surges in North Carolina. DHHS has reported 39 total flu deaths this season. Of those, 2 are children. 3 people between the ages of 25 and 49 have also died from the virus. 7 people between 50 and 64 and 27 over the age of 65. DHHS is urging everyone 6 months and older to get the flu and COVID vaccines.
The Kentucky Department of Health announces a tragedy, a pediatric flu death in Kenton County.
It's tragic, especially this time of year.
I called Skip Tate with the Northern Kentucky Health Department.
Unfortunately, the child didn't have a flu vaccine, which is really the primary tool in the toolkit when you want to try to fight flu.
Tate says flu numbers in northern Kentucky are down this year compared to the previous 2 years, but he says every year flu spikes after the holidays through mid to late February. Check out this CDC map. Kentucky right now is at a moderate risk, Indiana high, and Ohio very high.
We've been lucky to not have any deaths here in sort of southwest Ohio. We are seeing more and more flu activity.
Chris Peltier is the former president of Ohio's American Association of Pediatrics chapter. He says kids under 2 are most at risk, but no one is risk-free. Severe symptoms include high fevers, pneumonia, and worse.
We saw a few cases here in the Cincinnati area of children being admitted to the hospital with significant neurologic compromise and what we call encephalopathy, which is basically inflammation in the brain.
No details have been released about the juvenile who died in Kenton County, but Peltier says common protections involve frequent hand washing, sanitization of commonly touched surfaces.
They can live on a surface for 24 to 48 hours.
And, of course, get a vaccine for you and your kids.
What's your message to the people who may be hesitant to vaccinate their children at this time of year?
I would say the best protection against having severe complications of influenza are getting an annual flu vaccine. It is not too late. I think what this does is it offers a chance to talk about the flu vaccine, that it's safe, that while it's not going to protect 100% against disease, that it will hopefully keep most patients out of the hospital in serious trouble.
Okay, so Tate tells me if you want a vaccine, you could, of course, get it for no cost to yourself with insurance from a pharmacy. But if you're worried about cost or you're uninsured, you can visit their 4 health department facilities across northern Kentucky, and they will take care of you. Sean Delancey, WCPO9 News.
So if you've been thinking that this flu season feels way more intense than usual, you're not imagining things. Today, we're going to dive into the data and explain exactly what's behind this huge 2026 flu surge. Okay, to really get what's happening, I want you to look at this one number. Just let it sink in for a second. 19,053. So what is that? Well, that's the number of people hospitalized with the flu across the entire U.S. in just a single week. The week ending December 20th. But here's the really wild part. It's not just how big that number is, it's the speed. That's almost double the number from the week before. We're talking about an increase of over 9,000 people in the hospital in just 7 days. That kind of jump, well, that's what puts the entire medical community on high alert.
So, that single week was pretty shocking, right? Let's zoom out a bit and look at the bigger picture. We're going to break down the numbers for this whole season so you can really see what we're up against.
According to the CDC's latest estimates, the overall impact is already just staggering. We're looking at about 7.5 million people getting sick, 81,000 hospitalizations, and sadly 3,100 deaths so far.
And here's that jump I was talking about, but visualized. I mean, look at this. You can see the leap from around 10,000 hospitalizations straight up to over 19,000. That's a nearly vertical climb, and it's happening all over the country.
And look, this isn't just me saying these numbers are crazy. The experts are definitely sounding the alarm. Virologist Andrew Pecos points out that while the timing of the season is kinda normal, the sheer volume of cases and how fast they're climbing is something they just don't usually see.
So this all leads to one huge question. What is fueling this thing? Why is this season so different? Let's dig in.
Well, it turns out the main culprit has a name. It's called Influenza A H3N2 Subclade K. This is a new flu variant that was first spotted in Australia, and now it's the dominant strain that's driving this massive surge right here in the US. Now you might be wondering, is this variant more severe? Is it deadlier? So far, there's no sign of that. The real problem, as virologist Florian Kramer explains, is actually our own immune systems. Because it's a newer strain, we just don't have as much built-up immunity to it, and that's letting it spread like wildfire.
Which, of course, brings us to the million-dollar question that's probably on your mind. What about the vaccine? Let's take a look at our best line of defense. This is what everybody wants to know, right? Think about it. The vaccine was developed way back in February, long before this new Subclade K was even a thing. So, does it still work?
Okay, let's break this down. The concern is totally valid, but the early data coming out of the UK, which got hit with this same strain before us, is actually pretty encouraging. It looks like the vaccine is about 30 to 40% effective at keeping people out of the hospital. And while that might not sound perfect, experts say that's actually right in line with what they'd expect for typical flu season. It's still a really, really good tool.
But here's the catch. A vaccine can only protect the people who actually get it. And as of mid-December, only 42.2% of American adults had gotten their flu shot.
And that right there creates a massive protection gap. When you have a strain this contagious spreading this fast, having more than half of the entire adult population unprotected, well, it leaves all of us a lot more vulnerable.
So, given everything we now know, the most important question is what can you actually do to stay safe? Let's walk through a pretty straightforward protection plan. First things first, if you haven't gotten your shot yet, it is absolutely not too late. You hear this from everyone, including CDC Medical Officer Lisa Grovskopf. Getting vaccinated now can still give you crucial protection as the season continues.
The best way to think about this is a layered approach, right? It all starts with getting vaccinated. But then you can add more layers of protection, like wearing a good mask in crowded places and just being smart about social distancing. And finally, and this one is critical, if you do get sick, get help early.
And let's just focus on that last point because it's so important. This is not a tough it out kind of situation. There are effective antiviral treatments that work, but, and this is a big but, they work best if you start them within the first 48 hours of your symptoms. So, if you think you have the flu, call a doctor right away.
So, let's just put it all together. The soaring numbers, the incredible speed of the spread, and this new variant, they all point to one clear fact. This flu season is different. The good news is, we have the data and we have the tools to protect ourselves. So the only question left is, how will you prepare?
We are entering peak flu season, and a new flu variant known as Subclade K is spreading quickly across the country, driving a sharp rise in illness and hospitalizations. Public health officials say this current wave may last for weeks to come. William Brangham has the latest.
That's right. Just this week, according to the CDC, flu activity is high or very high in 32 states and jurisdictions. That's nearly double from the week before. More than 7 million people nationwide have been infected, and over 3,000 have died so far this season. Only about a quarter of adults and just 17% of children have received the flu shot as of November. So for more on the variant and what to look out for this flu season, I'm joined by Andrew Pekosh. He's a virologist at Johns Hopkins Bloomberg School of Public Health. Andrew Pekosh, thank you so much for being here. We know flu is a shapeshifter. It's why we have to design a new vaccine every single year. But this particular strain, this Subclade K, is proving to be quite a challenge. Tell us a little bit about it. Is it more contagious? Is it more dangerous?
Yeah, well, the first thing we know about this Subclade K virus, which is part of a larger group of viruses we call H3N2 viruses, is we know that it has mutations at a couple of what I call hotspots on the virus that are the targets of your immune system and that can generate those protective antibodies that minimize infection and disease. So this Clade K virus has changed from the viruses that circulated last year, and importantly, that it also has changed based on the vaccine that was distributed earlier this fall and is still available. So we think that the first thing that's going on with this Clade K virus is more people are susceptible because it's found a way to evade that pre-existing immunity in the population that is induced by either infection or by vaccination.
So is that why we are hearing reports that the current flu shot that people can get at the drugstore is considered not as effective against this particular strain?
Yeah, this year is what we call a mismatch between the vaccine strain and the circulating virus. We know there's a few mutations that will cause some of that vaccine-induced immunity to not recognize the currently circulating virus. And what usually results from that is we end up seeing a drop in the vaccine efficacy, particularly against infection. Now, it's important to note that even in a year when there's a mismatch of this sort, we oftentimes still see a signal of protection against severe disease that's associated with vaccination. So just because there's a mismatch in this Clade K virus doesn't mean you shouldn't take the vaccine. If you haven't gotten the vaccine already, still a good idea to take it.
There's still time to get some protection out of it for the rest of this season.
Yeah, the influenza vaccine takes about 2 weeks for you to generate a strong immune response to it. Flu seasons usually last anywhere from 4 to 6 weeks or longer. So even if you're in a part of the country that's starting to experience a rise in influenza cases, not a bad idea to go get vaccinated because it'll protect you against the tail end of the flu season.
I want to ask you a question about public health messaging. Recently, Dr. Mehmet Oz, who runs the Center for Medicare and Medicaid Services, one of the most prominent doctors in the Trump administration, was on TV and he was asked about flu prevention. And he ticked off a whole slew of things that people should do: getting more exercise, getting more sunlight, eating well, taking vitamin D, sneezing into your elbow. The only thing he said about the vaccine, the flu shot, was something like, "We know it doesn't always work that well and it's controversial." What do you make of that as a messaging strategy?
Well, certainly the healthier that you are, the better it or you will be at fighting off an infection. But there's nothing really controversial about the influenza vaccine. We know that it works. We know that it's safe. It does vary from year to year in terms of its efficacy, but that's primarily because we have to choose a flu vaccine 6 to 9 months before our flu season in order to have enough time to manufacture enough vaccine to distribute. And with this Clade K variant, for instance, it emerged after the vaccine was chosen for the Northern Hemisphere last February. So there really was no chance for us to make a better matched flu vaccine because of that manufacturing issues. So again, the vaccine works. It could be better, but certainly it works, and there's no reason why most individuals shouldn't take the influenza vaccine.
So who is most at risk from this flu right now?
Well, everyone can get infected, but when it comes to that severe disease, we're seeing a typical pattern, which is young individuals, pediatric populations, kids under the age of 11 are one prime area that is suffering from severe disease. And then individuals over the age of 65 are also suffering from more severe disease. Now, it's important to note that right now the data is saying that we're seeing a lot of flu cases and a proportionate rise in the amount of severe cases. So we're not seeing any data so far that says the Clade K variant is more dangerous to people than other H3N2 viruses that we've seen. It's just that more people are susceptible, and therefore we'll be seeing more cases and a corresponding or proportionate rise in the number of severe cases.
Do we know why some areas seem to be having bigger outbreaks than others?
Yeah, we think that every year, influenza, particularly here in the US, it appears in different states at slightly different times of the year. New York was unfortunate to be one of the first states that really got hit by this Clade K virus. And so we've seen the most experience in the US in New York in terms of how quickly that virus can spread and how many cases it can cause. Over the last 2 weeks, we've seen many states that have gone from basically no cases or very few cases to a very high number of cases. And we'll probably see the rest of the country see the same thing over the next 2 weeks or so. So it's not uncommon to see influenza appear in different states at different times. Sometimes that's just bad luck. That's where the virus lands first and starts spreading first, and then it moves from that area into other parts of the country.
All right, that is Indra Prakash of Johns Hopkins Bloomberg School of Public Health. Thank you so much for being here.
My pleasure.
The snow and the season come the sneezes, and we're seeing an uptick in specifically influenza A. And the patient that I'm seeing and the patient that I'm admitting also do not have any vaccination.
And now this strain of influenza, is it more severe than the typical strains that we see?
So that is an excellent question, and one that I'm commonly asked in the ED. So the design of viruses, just all viruses, whether it's adenovirus, influenza, rhinovirus, are to sustain their existence. And they do that by making variations to their existence so that the next year they come back a little bit better. And so in the context of this, specifically, there is a new variant. I'm going to nerd out here for a second. It's called Subclade K. And that is a variant for the influenza A that they have prevalent this year. However, that is what is suspected to be causing that uptick in the influenza that we are seeing in the emergency.
The Sub-K variant. Flu is like anything else. It's got to adapt to survive, and the strongest strains survive, and unfortunately they come and take root in our bodies. So you said that you're seeing a lot of folks that are not vaccinated. Just a normal flu vaccine would protect against this strain, correct?
So here's the thing, is that think of the vaccine, any vaccine, as a seatbelt. It doesn't mean you won't get into an accident, but it does significantly decrease the impact of the event. So for those specifically on the extremes of age, whether it's extremely young or older, that's who we're seeing present to the emergency room, and those are the ones we're seeing admitted to the hospital. So having this ability to boost your immune system so that you don't have to come to the emergency room, so that you don't have to be admitted to the hospital, has a huge impact on not only your family, the community, and your admissions to the hospital as well.
So thorny question here, because again, you piqued my interest when you said that. Are you just seeing fewer and fewer people getting vaccinated for the flu? And we might speculate as to why that is. Obviously, the director of Health and Human Services has been very skeptical about vaccines. Do you think that might be playing into this?
I think that contributes to the conversation. That definitely contributes to the conversation that comes into the emergency room, as it's, I understand, blah, 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 and I was told this. And so it's just a matter of just sitting down and meeting people where they are. Realistically, people who do not vaccine is something old. That is not something new. That was before COVID. Those individuals existed, and we just had a conversation. And again, it's just meeting people where they are and having a discussion on the impact of having the vaccination and how that decreases coming to the emergency room. Because you or I could have the flu right now. We're not going to the emergency room. But it's those populations that are being admitted and are presented to the emergency room where having a little bit of help to boost the immune system will have a huge impact on the rest of this holiday season.
for sure. So this is a concerning strain of the flu to watch out for. What norovirus? You know, I went down last winter right at this very time with a bad case of norovirus. Are we see? First of all, tell us the symptoms of norovirus and what are we seeing on that front right now?
Again, a great question. Norovirus is usually locked into the category of a respiratory virus, such as the flu or RSV, but it is not. So norovirus is specifically a virus that is dedicated to the gut. That's the intestine, that's the stomach, and those patients come into the emergency room with really bad nausea and vomiting. And the thing about norovirus is that it's shed in the stool. So the biggest thing about norovirus is making sure that individuals wash their hands. We have seen a huge uptick in norovirus, and specifically these patients come in with really bad stomach ache, they're vomiting, and they have really bad diarrhea, as opposed to the influenza or RSV, where it's the cough and the sneeze and the runny nose. It's a clear distinction. So glad you asked that question.
Yeah, I remember that was not fun, and it stuck around for about 3 days, and let's just say I had to station myself very close to the bathroom, or else it would have been a lot of trouble.
You know, and I appreciate your honesty. And here's the thing: that's most patients that come into the emergency room as well.
Yeah.
And the big thing is keeping the hands washed and hitting the doorknobs, the counter tables, keeping those areas clean, using something with an alcohol base to clean those areas significantly mitigates the impact of shedding and sharing these viruses.
A surge we see every year because of the holidays for both flu and norovirus.
We do.
I mean, people are together more. They're maybe not washing their hands. They're in their parties. They're in their gatherings. They're talking to each other.
And they're not only talking, it's hugs, it's kisses. You haven't seen anyone in such a long time, because usually we see the peak after Christmas. We see the peaks after New Year's. That's when everyone's coming together and celebrating the time, the year, the great season. And my recommendation is, hey, still do that. Still do the hugs. Still do the warm embraces. And it's great to see everyone. But let's keep our hands washed. And if you're not feeling well, give yourself that grace. Give yourself that time to get a little bit better. Give yourself 24 hours, and then you're back on the seasonal scene, having great fun with family and friends, and everyone remains healthy.
Yeah, you know, for Thanksgiving, I got a really bad upper respiratory virus, and I had to call my family and say, look, I got to miss Thanksgiving this year. I don't want to get everybody sick. It's just what happens. You know, unfortunately, sometimes you gotta take one for the team.
Touche. Taking one for the team, which goes back to the Bears. Yesterday, and as a city, we've got to come together. The Bears need us right now.
Oh, they do.
We have to be healthy.
They need us. They need us full throated, and they need us healthy, and they can't be getting sick. And we get it.
Touche.
Yeah. What about the whole notion of depression, seasonal depression during the holidays? Is this a real thing? Or is it something that maybe is more perceived because everyone's just so stressed out with deadlines and gift giving? Do people really feel more depressed or full of anxiety during the holidays?
So that is in fact a real thing, and these patients will present, and there's a lot of things that attribute to this. Number one, there are so many deadlines that we have at the end of the year, whether it's work, family, gifts, getting things together, getting meals together, that attributes to this laundry list of things that are on this list. Coupled with that, it's getting darker earlier. And it's 5 o'clock, it's really, really dark, it's cold, so you're away from other family members, you're not outside as you would. And so that seasonal depression is in fact a very real thing. And that's something that patients will present to the emergency room as well, or with their family practice doctor or their pediatrician.
So they'll present to the emergency room. How does it present in terms of someone showing up at the emergency room? I mean, could it be substance abuse? Could it be they tried to harm themselves? Do you see a spike in that?
Well, there's a myriad of different presentations when it comes to any sort of depression, whether it's an increase in alcohol use or it's just the being distant from family members, where sometimes a family member will bring another family member to the emergency room, or someone just comes to the emergency room and states, I've got the seasonal blues. We get that quite often as well. And it's just a matter of behavior, and it's tailored to who you are and those concerns. Sometimes it's ensuring that you plan things outside or sometimes inside, in a place where you can interact with individuals. It's behavioral modifications that have a huge impact on a better outcome during these cold and darker seasons.
All right, so what are some of those behavioral modifications that you recommend?
Number one is be deliberate. If you feel as if, hey, I feel as if I'm not outside, so I'm not with friends, make a time meeting at Starbucks. Make a time to meet at Target, TJ Maxx. So if you want to do shopping with friends, walk dogs with neighbors, do something that interacts with other individuals so that you can decrease the time alone, or decrease the time in which you would acknowledge that, hey, usually I'm with someone else, or usually I'm outside. So be deliberate and ensure that you are doing something with other individuals. And also, the big thing is check in on family members. Check in on family members. We very often have patients come to the emergency room, and then their family members come to the emergency room, and the first thing they state is, we didn't know, or we didn't see this coming, or in some capacity where no one spoke with that individual for 2 weeks. No one spoke with them for 3 or 4 weeks. It's the season to be jolly. Call your friends, check in on them, make sure they're doing well, check on their Christmas list, New Year's plans, and then that can spark the conversation to move in a better place for health and for happiness.
Seems like common denominator here is don't be alone. You know, isolation during the holidays it can be one of the worst things.
Yes. And communicate.
And communicate.
Yeah.
What about, you've got some tips on staying out of the emergency room during peak season right now. So is this peak season? I mean, do you start to see really like busy emergency rooms around this time? And then what are your tips to stay away?
So this is the two things we have. It's the Christmas bump and the New Year's bump and pre-bump. So we call New Year's the amateur night. Totally different. I can come back and talk about that. But we could talk about New Year's. And usually in the Christmas season, we usually have a bump 3 or 4 days after Christmas because everyone's gotten together. And then you have the flus, you've got the fevers that don't go down. That's what we usually see. We see the upset stomachs that come after Christmas. Those are usually what we see. And the recommendation is always hands washing, hit the doorknobs, hit the countertops. And if you are in social spaces, make sure you are in those social spaces and continue to wash hands, and avoid those social spaces if you're not feeling well. That significantly decreases the ER presentations and to the family practice clinics as well.
I know my own personal stomach problems after the holidays come from overeating, maybe a little overindulgence of some of those Christmas cookies and sweets and candies, and it's time to. I've been hitting the gym as much as I can, Dr. Colbert, believe me. But what about general wellness, physical wellness after the holidays? Everyone starts to make New Year's resolutions, but then it kind of falls off into the new year. Is it important to make a plan to be consistently physically active?
And so here's the thing, everything in moderation. My biggest comment to all patients is today's the first day of the rest of your health. Today's the first day of the rest of your health. And the biggest hack in life is consistency. I'm not saying you've got to run 3 miles every day. Maybe run 3 miles one day and 3 minutes the next day. That's totally fine until you get to the pattern of, hey, I can run 1.5 miles every day. And also, you don't have to run every day. Sometimes you can just walk your dog one day. Any activity enhances it. Here's a secret. Outside exercise, it's always enhanced by a pet. You are more likely, I'm not saying get a pet to exercise. What I'm saying is if you have a pet, bring Scruffy or King or whomever with you when you go on your walks. You're more likely to increase exercise in that capacity. Going back to what you communicated about the holiday season, there's nothing wrong with indulging in the holiday snacks. No one ever eats pound cake except during Christmas.
Right.
No one ever eats cranberry sauce unless it's Christmas or Thanksgiving. Two of the biggest things that cause reflux in the emergency room. I'm like, hey, what'd you have to eat today? I don't know, just a whole lot of cranberry. We never eat cranberry sauce throughout the year, except during Thanksgiving and Christmas. And so everything in moderation. eat the chocolate cakes, eat the chocolate pies, have the turkey and the cranberry sauce, but take it easy so you can watch the remainder of the football games.
Yeah.
Because usually around the second football game, that's when your reflex is like, hey, I don't think I can make it past halftime. And then they come to Bernie's room, and the first thing they ask is, hey, I think I need a Pepsid, and which of your rooms has a TV so I can watch the remainder of the games?
Well, that was everybody last night, I think, needing the Pepsid after that back and forth battle. But I think Bears fans will take it. We'll take the extra stress and action with our nervous system because they're good and it's fun to watch, and we get the endorphins from watching a really great football team, even if they come up short.
You know what, everyone, bear down on good health, bear down on watching these Bears succeed, and everyone, I wish the best for this holiday season. Stay healthy so you can really engage and be a part of all of these beautiful, beautiful season here we have in Chicago with the holiday season and with the Bears.
All right, Dr. Chris Colbert, it's great to engage with you as well. Thanks for giving us these very useful tips.
I appreciate the invitation. Thank you.
Okay, we'll talk to you soon.
As promised, we are here at YouTube, and I have typed Subclade K into the search bar, and I have refined the search filters to searches from today only. And now there we can see the first one was from Philadelphia, flu variant Subclade K fueling surge in sickness. Now this was another one of interest because look, there is a new flu strain, a nurse alert, and this is kind of a public safety announcement, I guess. You can sort of see there for yourself. It's like one of those flyers that we saw back during the COVIDian era, where these were sort of on buildings and businesses and premises, giving public safety announcements in advisory notifications, but why flu season is so bad and how you can prevent it from a PBS NewsHour. But this is where it gets interesting, folks, because until today there has been absolutely very little word about this affecting Indonesia. But as you can see, there has been an absolute abundance of videos about Subclade K, the super flu coming out of Indonesia. There is the first one. There is the second one. This is also a little bit interesting. It's got no views. I get more views than you, and nobody watches my channel, HIV, the Undetectables. And that is a little bit like a sort of the first sort of example I've seen of maybe a conspiracy theorist's point of view from regarding the influenza variant. Here is another one from Indonesia. It is a short 62 cases of superflu, Subclade K. I'm not even going to try to read Indonesian, but there is another one, widespread superflu, Subclade K, 1,800 views 21 hours ago. Another short look, 2026 Indonesia influenza H3N2 Subclade K. Another one, Subclade K, Anish Abdallah MD, no views. Superflu, another Indonesian one, 11 hours 55 minutes long was that one. So a lot to be involved in that. I'm not going to sit and watch 12 hours of Indonesian reels to see if there's any interesting content in there for you guys, but you can see for yourself that there is quite the abundance of Indonesian newsreels reporting on Subclade K, and it's sort of, I mean, I'm sure it will end sooner or later, but let me speed up my scrolling. There's one from New York to break it up. There's one from Florida as a new variant drives it up. Back to Indonesia. More Indonesian news reports about the super flu. So it really, really, really is. I mean, look at this, guys. It is all from Indonesia except for this one, and this is from the Hindu Times, I think, or obviously an Indian news outlet. It doesn't actually say anything about Subclade K in the title, but it showed up in the search, so one can only assume it is about that. More Indonesian news related reels about Subclade K. It's all Indonesian, folks. In Indonesia, sort of like Hong Kong, like Thailand, like India, is a nation that is very, very densely populated, and parts of that nation are not exactly as sanitary as probably places in the Western world, although Flint, Michigan. But that is got down to the bottom. That is all the videos that were uploaded today, and nearly every single one of them, bar probably 2 or 3, were all from Indonesia. So it is getting global, folks. It is getting to be a worldwide problem, although we're hearing the majority of the stories in the Subclade K are coming out of the United States regarding the spread of this mutant variant superflu Subclade K. So we're going to wrap the Subclade K content in articles up at that point, but I do have one more article and one more video to show you before we return to the basement to wrap things up, and I'm sure some of you are eager to see the dancing girl put an end to this evening's proceedings. But not only do we have Subclade K and norovirus, and there was that British bum fungus a month or so ago that was pre-warned that could become problematic. We also have measles to add to the list of growing viruses, as a bunch of people have been exposed to a strain of measles. So stay tuned for that. So here we are at AlJazeera.com. South Carolina measles outbreak grows to 185 cases amid vaccination worries. This outbreak comes after US charted its highest number of annual measles cases in more than 3 decades in 2025. So another record-breaking virus that is now appeared and is causing problematics, and this only come out a few hours ago. Officials in the United States have announced that the measles outbreak in the southern state of South Carolina has grown to 185 cases, up 9 from earlier this week. In Friday's update, the state officials specified that 172 cases involved patients who had not received the measles, mumps and rubella MMR vaccine designed to protect them from infection. The WHO warns $1.7 billion funding shortfall threatens polio eradication efforts. Why has Canada lost its measles-free status, and could the United States be next? Yes, it is, as this article is stating. And Sudan's Darfur grapples with severe measles outbreak amid ongoing violence. So the Sudan's got violence and measles to contend with. And in South Carolina, they have norovirus, they have Subclade K, and they have measles. 4 others involved patients were partially vaccinated. What happened? How do you partially get vaccinated? Explain that to me if you can. But 4 had an unknown vaccination status, and another 4 cases are still under investigation. Only one of the infections involved a fully vaccinated person. Measles are highly infectious and sometimes deadly virus, as is the case with norovirus and Subclade K, although the bum fungus wasn't deadly. It was just embarrassing and annoying. It was declared eliminated in the United States more than 25 years ago, but all of a sudden it has reared its ugly head and reappeared, a little bit like Hollywood rebooting previously produced movies. We're probably seeing the same with measles. It's rebooted itself and coming back bigger and badder than ever. But the past 3 years has presented increasing challenges to maintaining that status. Diseases are generally declared eliminated when there is no local transmission in a given region. So if it's eliminated, how does it sort of come back and start transmitting itself? Although cases can still be imported from abroad. Of course, they're also imported from abroad. They would never be released in the United States by United States organizations. But the US's elimination status is largely credited to the success of the MMR vaccine. In 1963, the first measles vaccine was licensed in the United States, and by 1971, the combination MMR vaccine was unveiled to protect against the 3 illnesses at once. 2 shots are particularly recommended to achieve full vaccination status. Initially in 1978, the US Centers for Disease Control and Prevention set 1982 as a deadline deadline to achieve the elimination of measles in the country, and it missed that target by nearly 18 years, reaching elimination status in 2000. So I suppose that's how you're only partially vaccinated. You need 2 doses, or if you only have 1, it isn't going to be as effective as if you have 2. But vaccine hesitancy has been blamed for allowing the virus to spread in the United States now and then. Well, the death rate from measles is relatively low. Its infection rate is high. The CDC estimates that if one person has the virus, they could infect 9 out of every 10 people around them. The World Health Organization says that for every 1,000 reported cases, there are about 2 to 3 deaths. Children are especially vulnerable. Complications can include high fever, hearing or vision loss, and encephalitis and an inflammation of the brain. Not very pleasant at all. Typically, medical professionals recommend children to be vaccinated early in their lives, receiving their first dose before 15 months of age and their second by the age of 6. The vaccine is widely accepted as safe, but vaccine skepticism has been on the rise in the United States, with critics blaming in part policies implemented under the administration of Donald Trump. According to the CDC data, the MMR vaccination rate in the US was 95.2% among kindergarteners during 2019 and 2020 school year. That number, however, tumbled to 92.7% by 23-24 school year, and representing a difference of 280,000 kindergarteners. 2025 represented a high watermark in the resurgence of measles virus, and the CDC reported that 2,065 cases of measles last year, the most since 1991, folks. We're hearing that in every single one of these viruses, that they are the highest they have been in years. And more than 7 times the rate of 2024, when only 285 cases were reported. One of the biggest outbreaks took place in Texas, where 3 people died from the virus, with the first reported last February. Prior to that incident, no death had been reported from the measles in the United States since 2015. In the wake of that death, Trump's Health and Human Services Secretary Robert F. Kennedy Jr. encouraged vaccination, writing on social media, "The most effective way to prevent the spread of measles is the MMR vaccine." But Kennedy, who is not a medical professional, has since expressed views that appeared to discourage the vaccine's use. In late April, for instance, he told News Nation the MMR vaccine contains a lot of aborted fetus debris and DNA particles. Experts, however, have denounced that claim as false, while the rubella part of the vaccine was developed using cell culture that came from elective abortion in the 1960s. No fetal tissue has been used since, nor is there any fetal tissue in the vaccine. Kennedy has also spread unfounded claims that purport to link vaccinations to autism, despite widespread outcry from the medical community. But in South Carolina, the current measles outbreak is concentrated in the Northwest. The South Carolina Department of Public Health says that the reported infections are largely in children under the age of 17. One Democratic candidate running in the state's 2026 midterm elections, pediatrician Annie Andrews, AA, has made combating the outbreak a central part of her campaign. She hopes to unseat incumbent Senator Lindsey Graham as a Republican in November's vote. If you told me back in medical school that someday I would be running for Senate and my campaign slogan would be "It's me or the measles," I would definitely not have believed you, she wrote on social media on Friday. And that is that, guys. So measles has also entered the mix as another evil villain virus that is causing an outbreak in Southern Carolina. And where else was it we heard about that it was causing? But another place around the world is also experiencing measles. So let's just listen to a video about the measles, and then I will see you in the virtual basement, and we will wrap things up for tonight.
The Contra Costa Health Department is warning thousands may have been exposed to measles in Walnut Creek. Officials say the infected person, now in quarantine, visited several stores at Broadway Plaza during the week of December 15th. Health officials are urging people to monitor for symptoms which can appear up to 3 weeks after exposure and to talk with a doctor about vaccination. Flu cases are on the rise amid holiday gatherings and the peak travel period. The new flu variant, Super K, has proved especially difficult for young children to handle. KTVU's Devin Truby has more of what you need to know.
The flu is spreading rapidly in the Bay Area. The positivity rate here now higher than the national. New influenza data released Tuesday showing a flu season that's ramping up to be a severe one.
What we're seeing is in California a real rapid increase in the number of cases of influenza over the past few weeks since early December, more than 4 times number of cases since early December.
Dr. Dean Blumberg is the chief of pediatric infectious disease at UC Davis. The Sacramento region has already seen 1 child death from the flu so far this season. According to the California Department of Public Health, there have been 64 flu deaths so far this season across the state and 3 pediatric ones.
But we think that young children are being primarily affected more severely. That's what we've seen in other countries where it's those less than 24 years of age have had really very high rates of hospitalization and ICU admission. But of course, we're always worried about those at the extremes of age. Those less than 6 months of age always have more severe times with influenza, as well as those 65 years of age and older.
Almost all of the positive flu cases have been linked to influenza A. That's where the new subvariant Super K stems from that's linked to a majority of cases. Wastewater testing shows that influenza A is high in the Bay Area.
This particular year, this variant, which is a subvariant of H3N2, it has several mutations in it that make it not a great match with the H3N2 strain that was included in the flu vaccine this year.
Doctors are still recommending you get a flu shot. Those who are vaccinated see a 70% reduction in hospitalization among children and 30% amongst adults. If you do get sick, doctors say it's important to test and seek care quickly because most antiviral therapy to fight the flu needs to be received within 24 to 48 hours to be effective. There's still time to get a flu shot if you decide you want one. It'll take about 2 weeks to become effective. Reporting in the studio, Devin Truby, KTVU, Fox 2 News.
So welcome back to the virtual basement, folks. Hopefully those of you who have made it this far have found this evening's video nobody is gonna watch interesting and informative. I can't exactly go out of my way to say that this has been an enjoyable video because it's sort of getting a little bit alarming and concerning to me, and hopefully to those of you who have been following along this sort of every single weekly update we have done so far on Subclade K. The numbers are rising at an alarming rate, and in this video the fear mongering has been ramped up and they are now reporting on child deaths, and that was also the sneaky additional virus to enter the fray, the measles, which is also targeting children for what apparent reasons. It has come back out of its elimination. It's been rebooted and is causing some problems down there in Southern Carolina. It is also contending with an outbreak of Subclade K and norovirus. So we've got a whole bunch of mutant viruses running rampant. We're seeing hospitalizations rising, we are seeing the death count rising, and we are hearing that there are children involved or included in those death counts. So the narrative, guys, it is becoming more and more and more carbon copied of that of the COVID narrative, and as we are now out of the Christmas holiday period and entering into a sort of phase of normality, what January and February are going to bring us with this ongoing Subclade K stroke norovirus, and should we even put stroke measles epidemic? Is it going to reach the level where we're going to see another pandemic, lockdowns imminent? It's sounding as though that might be the case. Can't say that that is going to be the case, but if you are one of the regular offenders that does actually watch RD, be sure, as sure can be, that we will be staying on top of this story for the duration that it is relevant, I guess, until it is done and dusted, and hopefully we won't have to be coming back at some point in the not so distant future with well, I did tell you so, but it does seem, and it is, as I've mentioned several times in previous videos, the echoes of COVID are ringing extremely loudly, and the similarities between narratives are almost identical. It's like they are using the same script, which is something they often do with sequels. They just sort of use the script from the first movie and just sort of make it a little bit longer, a little bit badder, add some extra special effects and some extra villains, and wham bam, thank you ma'am, you've got yourself a sequel movie. And are we about to experience a sequel to the pandemic of 2025? Let me know what you think, as always, in the comments below if you are watching subsequently, or if you are part of the live chat watching this as a premiere. Pipe up with your thoughts and opinions in the comments in the live chat, and let's see what you have to say about it. As always, I do encourage contextual comments as much as possible. But thank you for those of you who have made it this far and tuned in to watch RD this time round. As always, your time and attention are greatly appreciated here, as they are some of the most precious possessions you can give. So all that remains to be said this time out is, until we see each other again, please be excellent to each other. May the force be with us all, and take care until next time. This is RD signing out for now.
Sit, Ubu, sit. Good dog.
Be excellent to each other. Party on, dudes!
Hey, Luke. May the force be with you.
All right. Take care now. Bye-bye then.